Like many clinical services, COVID-19 has had and continues to have a significant impact on the delivery of outpatient services. The Northern Ireland Regional Glaucoma Service is one such service, based in the Belfast Health and Social Care Trust, that not only ceased to provide outpatient services, but lost use of one of its buildings due to redeployment as a COVID-19 centre. As we in clinical engineering have been developing our clinical computing knowledge and skills to meet the increasing challenges of supporting a fast-changing healthcare environment, we were well positioned to help. Devices are no longer used independently, but are integrated with often multiple complex clinical systems. Therefore, understanding the medical device technologies, the general ICT communication standards and protocols, as well as medical device specific ICT requirements, devices and systems can be safely and effectively deployed.
My name is Angela Knox. I'm consultant ophthalmologist and clinical lead for the glaucoma services. In recent years, the ophthalmology department has become very reliant on technology, not just on the capture of images on devices, but also the networking of those devices to allow the seamless integration of clinical exams across a variety of locations. And the networking of devices is immensely important for clinical and patient care. It enables me to be able to work in the glaucoma service here in Belfast and be able to see in real time the visual field tests and the disc imaging of a patient that has been performed on a visual field machine and on a camera system in a different clinic location in a different hospital trust. The advantage of that is that we can have rapid sharing of clinical expertise, and it also vastly improves our options in being able to perform imaging clinics and the reading of those imaging clinics by consultants in a variety of locations. The process of networking devices is complex and challenging. It involves a variety of individuals, the stakeholders, the clinicians, the hospital IT personnel, and the manufacturers. The clinical engineering department plays a vital role in liaising with those individuals, in assessing the needs and requirements, and of overseeing the project to fruition. The vital role that clinical engineering plays is demonstrated in the recent challenge that we had due to the COVID-19 global pandemic. We have an outpatient department, a glaucoma clinic in the Banbridge Polyclinic, and almost overnight that clinic in March of this year was converted to a COVID testing unit. The equipment was put into storage in various locations and the clinic was closed. And it was obvious to us that we were going to have to find another clinic location as the polyclinic was likely to be closed for some time. We were given the option of moving the clinic to the outpatient department in the Southern Trust South Tyrone Hospital in Dungannon, 30 miles away. We wanted to move as quickly as possible, as the closure of the clinic had had a huge clinical impact on the glaucoma service. We rely on clinics running all the time so that patients can be seen in a timely fashion, as glaucoma patients require regular follow-up to detect progression and to prevent irreversible blindness. The clinical engineering department stepped in quickly to facilitate the move. This required the moving of expensive and fragile equipment to the new location, liaising with the clinicians regarding room layout, and ensuring that there was suitable and appropriate networking points, making sure that those networking points were configured, and liaising with the IT department in both the Southern and in the Belfast Trust, and checking the functionality and the networking of the devices once they'd been reinstalled. This was a move that we just could not have contemplated without the involvement of the clinical engineer. The clinical engineer was able to bring together the jigsaw pieces and make the move successful and make it happen.
As healthcare technologies and devices become more immersed within and integrated into the delivery of healthcare across hospitals, trusts, regions, health and wellbeing centres and within patients' homes, further investment will be needed to ensure clinical engineering teams have the resources, knowledge and skills needed to meet the challenges of the future. This project exemplifies the increasing need for clinical engineering to lead on the adoption and integration of healthcare technologies within the healthcare ecosystem.